Okay, osteoporosis. How is osteoporosis different than osteoarthritis? Okay, we'll get into this and we're going to discuss it, but you're going to be able to understand very clearly what the difference is between the two and how to kind of do the assessment for each of these patients and how you're going to be able to identify it. So here is going to be the spine of a patient with osteoporosis. You can see kind of this kyphosis here, and we'll get into that. But these bones really kind of become soggy. So what happens is the bones start to demineralize, and this leads to a decrease in overall bone mass, okay? On top of that, the bone starts to resorb faster, and this leads to calcium loss. This calcium loss also leads to porous bones, okay? So, our bone, this resorption helps kind of recycle bone and get the bone rebuilt again. But what happens is this starts to occur at a faster rate. This causes a decrease in calcium, and we end up with porous bones, okay? So normally our bone would be nice and thick. This patient with osteoporosis is going to have all these pores in their bone, making them soggy is kind of one way that we like to refer to it, and making them very weak, where the bone that has all these little holes in it is obviously going to break much faster than something that's solid and still. So think of like a steel beam versus like something with all, a piece of wood with all these different holes in it. It's not going to be nearly as strong. It's more common in women, okay, and then there's a high risk for fractures, of course, like we talked about. You have this porous bone, and there's a good chance that this bone could break and fracture on this patient, okay? So some of the assessment findings we're going to see. So if a patient is using steroids can actually lead to osteoporosis. Okay, so steroid use, one of our, and again, you'll see this in the MedMaster course, we'll talk about it, but one of the side effects of steroid use is osteoporosis. The patient will more likely than not be female. They may have a decreased calcium intake. Though you might notice kyphosis of the spine. The kyphosis is this out kind of curvature, where lordotic is going to be kind of an in curvature. So the kyphotic curve is going to be kind of an out pouching of the upper spine. They may have bone pain, and they may have fractures of the pelvis and hip. Okay, so those are kind of some of the things you're going to see. What we need to do with our patients is we need to provide calcium supplementation and encourage vitamin D intake. So why does your body need vitamin D? Well, vitamin D is required to absorb calcium. So we can take as much calcium as we want. We can throw all this calcium at the patient, all these calcium supplements, but without vitamin D, our body can't really use that calcium. So vitamin D goes along with calcium. We need it to make it work. Weight-bearing exercise, and this needs to be done with supervision of like a physical therapist or an occupational therapist, but providing weight-bearing exercise helps those bones develop mass and become stronger. Okay, not only does it strengthen our muscles and things, but it also helps increase bone mass. We need to provide a hazard-free environment. Remember, the patient is going to be at a high risk for falls or for breaking bones, so we want to prevent falls. And again, this is more likely to occur in elderly patients, so they're already going to have mobility issues. Throw that on top of the fact that their bones are basically just porous. And if they fall, there's a high risk of them breaking something. So we'll provide assistive devices that are appropriate for the patient, walkers, canes, whatever they need to be able to get around. And some of the medications we're going to provide are going to be Fosamax. So Fosa is a medical term for bone. So one way to remember that it's going to help the bone is Fosamax. Resindronate. Those are going to be kind of the two medications we're going to give for osteoporosis. Alendronate and resindronate. And you may notice here the dronate suffix are going to be medications we use for osteoporosis. These medications need to be given 30 minutes prior to eating. We want to make sure that the body has time to absorb these medications and it's going to work better prior to eating. Okay, so this is one of those medications that needs to be given prior to mealtime. Okay, so that's the basics of osteoporosis. If you guys have questions, be sure to let me know. But hopefully that kind of helps you understand the difference in osteoporosis and osteoarthritis. Remember, with arthritis, we're talking the joints specifically, and we're going to see those Bouchard's and Herberdin's nodes. With osteoporosis, we're talking about the bone itself becoming porous and leading to breaks and fractures. Where with osteoarthritis, we're talking the joints and the joint pain and systemic, okay? So if you have any questions about that, be sure to let me know.